Hi everybody, so we don't have any Q&As, so please keep in mind that I do appear and have Q&A sessions every Friday, and so it should be a tagged post in this private group of Lupus Rebel in Facebook. Keeping that in mind, I've been thinking long and hard about the condition I was hospitalized for recently, which caused a very severe sickness. So I wanted to talk a little bit about it. It's a very rare case. It's called Plaquenil-Induced Pancytopenia. Okay, so a rare case of Plaquenil-Induced Pancytopenia. It was reported in literature for a 71-year-old woman with poorly controlled rheumatoid arthritis after several months of being on Plaquenil. And it was reported by European Journal of Rheumatology in 2016. I don't think this is a common side effect. It's for sure a very rare one. And it's one that shook me up a bit last month. And it took most of my May of 2019. As many of you asked me why I was so sick, but this was a testament to just how much we don't know. As Plaquenil was a medication to keep my lupus in remission, and while it did just that, it also created a dangerous situation for me personally, to where I had staph infection in the blood with no white cells or neutrophils and declining platelets. I was considered septic in the hospital. And I'm so thankful for my rheumatologist who oversaw my care in the hospital, who did the research to find this potential cause and stop the Plaquenil 5 days into my hospital stay to turn my leukemia or leukopenia or pancytopenia around. It's important to note that Plaquenil was one of the meds that were prescribed for me to take daily in the hospital. And it was the last thing any of the doctors suspected. Even after my rheumatologist suspected this, my hematologist, oncologist, infectious disease, and my internal medical doctor were all skeptical. So if you're going through a similar experience of declining white blood cells and neutrophils and platelets specifically, I recommend you ask your doctor about this ASAP. It's also important to keep in mind that all medications do have unintended consequences, and to always understand why you're taking certain medications that you're taking. It's important for us to be good stewards of our body and our health by asking questions, and don't just take things blindly. If it doesn't make sense to you, ask your doctor to help you to understand why and what it is that they're asking you to take. I hope this helps, and if you like this podcast or YouTube channel, we have various venues to put this information out there for you. Please subscribe to my YouTube channel, Dr. Connie Jian. I also have a website, lupus-specific website called lupusrebel.com. I share tons of good free information there. I also have a private practice, alkalinewellness.com. As well as you can find me on social media handle at Lupus Rebel, both on Pinterest, Instagram, and Facebook. With all that, I hope you guys all enjoy your weekend, and I'll see you guys next week.